My name is Laura Allen, and this is my head-to-toe assessment. Prior to coming into the room, I have washed my hands. My patient has emptied his bladder, put on a hospital gown, and we've recorded his vital signs, which were all within defined limits. We checked his height and weight, and we did some vision screenings, which include the Snellen and the Rosenbaum chart, which his vision was 20/20, which shows the patency of cranial nerve 2. So I want to note that my patient is a healthy appearing young male and no acute distress. Skin is nice and pink. The eyes and ears are symmetrically placed. Can't see any evidence of any obvious lesions or nodules. So to begin, we're going to assess cranial nerve 5. Please tell me if the sensation you feel is dull or sharp.
Dull. Sharp. Dull. Sharp. Dull.
Great. Now we're going to test cranial nerve 7. Can you furrow your brow and squeeze your eyes tightly shut and puff out your cheeks and then show your teeth? Great. Moving on, I'm going to palpate the skull and the facial bones. So the head is normocephalic and atraumatic. I don't feel any obvious nodules or bony deformations. The scalp is clean and dry. The hair distribution is even. The hair is soft and smooth. Going to feel the sinuses for any edema or pain. Does this hurt you?
No.
And what about here?
No.
Okay. I'm going to feel the temporomandibular joint. Can you open and close your mouth, please? I'm feeling for any crepitus or pain. You can stop, which I don't feel any. Does this hurt you?
No.
Okay. The joint movement was smooth. So moving on to the ears, I want to note that the ears are pink and symmetric. I don't see any obvious nodules or lesions or any exudate. So I'm going to feel the auricle, which again is nice and smooth. The temperature is warm, and I don't feel any nodules. So I'm going to test cranial nerve 8 by performing the whisper and the RIN test. If I could have you occlude your right ear, please.
821. I couldn't hear that. 836.
Okay, great. So now I'm going to do the RIN test. I'm going to strike my tuning fork and place it on your mastoid bone. Please tell me when you no longer feel the vibrations.
Okay.
And please tell me when you no longer hear the vibrations.
Okay.
So this is a normal finding. With the RIN test, air conduction should be about 2 times longer than bone conduction, and you would repeat this in the opposite ear to assess for symmetric hearing. Moving on, I'm going to look at the eyes. I want to note that the eyebrows are present symmetrically. I don't see any evidence of hair loss. I don't see any evidence of discharge in the eye. I don't see any redness. The eyelashes are both present bilaterally. So I'm going to assess cranial nerve 3, 4, and 6 by I'm going to check your extraocular muscles. I'm going to perform the 6 cardinal fields of gaze test. If you could follow my finger. Okay, great. What I'm looking for is that I have symmetric eye movement in each field of gaze and that I don't see any evidence of nystagmus, which in this instance I did not. So while I'm here, I'm going to check your ability to see in your periphery. If you could look at my nose, and I'm going to hold up fingers, I want you to tell me how many.
3, 2, 1, 1, 2, 3.
Great. I'm also going to look at the pupillary response to the light reflex. We have direct, consensual, direct, So his pupils are equal, round, and reactive to light and accommodation. So now I'm going to look at the conjunctiva and the sclera. The conjunctiva are nice and pink. I don't see any redness or exudate or any nodules. The sclera is white. I don't see any evidence of jaundice. The lacrimal apparatus is free of nodules. I have the same findings on the opposite eye. So moving on, I'm going to look at the nose. I want to note that the nose is straight, and it appears that the septum is midline. So I'm going to palpate the nose. Great, and indeed I have a midline septum. Looking in the nose, I see that the nasal mucosa is nice and pink. The septum is midline. The turbinates are pink and without edema. I don't see any evidence of polyps. Okay, I'm going to include one nair. Please breathe through the other. Okay, I'm going to include the other. Great. So each nair is patent. Okay, so now I'm going to look at the mouth. I notice that the lips are symmetric. I don't see any evidence of dry or cracked lips. Pull this down and look at the oral mucosa, which is nice and pink. The gingiva is also nice and pink. I don't see any areas of redness or ulcerations or lesions. The teeth are intact. I don't see any evidence of loose, chipped, or cracked teeth. Can you stick out your tongue for me? Okay. Can you move your tongue towards your nose and down towards your chin? Great. And from one side to the other. Okay. So the tongue has good movement, which is a good indicator of the function of cranial nerve 12. Go ahead and stick that tongue out for me and say ah. Okay, looking at the hard and soft palate, it's intact. The uvula is midline. The tonsils are 1+ without edema or redness or exudate. Going to test cranial nerve 9 and 10, which we do that by looking at the ah reflex and the gag reflex. So go ahead and say ah again for me. Okay, sorry about that. Okay. You okay?
I am.
Okay. So that concludes the facial exam. So now I'm going to look at the neck, noting that the neck appears to be supple. The trachea appears to be midline. I don't see any evidence of jugular vein distension. So I'm going to have you check, I'm going to look at your range of motion in your neck. Can you look up at the ceiling for me? Great. And can you look down at your chin? Great. And look up that way. And that way for me. Awesome. So the range of motion is not limited. And the movement was smooth. Did any of that cause you pain?
No.
Great. Okay. So I'm going to assess cranial nerve 11. Can you shrug your shoulders? Great. And turn your head against my hand. Wonderful. Don't let me push you back. Great. So cranial nerve 11 is working properly. And now I'm going to begin with palpation. I want to feel the trachea, making sure it's midline, which it is. Now I'm going to palpate the thyroid. I'm going to slightly displace the trachea. And the thyroid is firm and smooth. I don't feel any evidence of nodules. Can you swallow for me? Great. And now I'm going to palpate the carotid artery, one at a time. This is 2+. Wonderful. I did not feel any evidence of thrills either. Now I'm going to check for a bruit using the bell of my stethoscope. Please hold your breath. Okay, you can breathe normal. I did not hear a bruit. So now I'm going to listen to the thyroid for any vascular sounds, which I do not hear. Great. Before I move on, I'm going to palpate the lymph nodes, beginning with the pre-auricular and the post-auricular, the tonsillar, the submandibular, the submental, the anterior cervical chain, the posterior cervical chain, the deep cervical chain, the supraclavicular, and the axillary, and then also the infraclavicular. Okay, so what I'm feeling for are any hardened nodules or any tender nodules, paying close attention to whether or not these nodules are fixed. In this particular patient, there's no evidence of lymphadenopathy. I wasn't able to palpate in any of the lymph nodes. Did anything I do cause you any pain?
No.
Okay, great. So now I'm going to move on to the upper extremities. So I want to look at the arms, noting that I don't see any evidence of muscle atrophy. The muscles appear to be in good shape. I don't see any joint redness or any joint deformations. Moving down, as I mentioned, the skin is pink. I don't see any evidence of clubbing of the fingers. The fingernails are nice and trimmed. Okay, I'm going to palpate. The skin is nice and warm. The hair distribution is symmetric. As I mentioned, I don't feel any tenderness or deformations in the joints. Feeling the brachial pulse is 2+, and the radial pulse is 2+, okay? And the capillary refill is less than 2 seconds. Great. So just to repeat on this arm, the skin is also warm. The brachial pulse is 2+. The radial pulse is 2+. Capillary refill is less than 2 seconds. And I don't see any evidence of clubbing. Okay. If I could have you turn around.
This work?
Yes. So I want to note that his respirations appear to be even and unlabored. I don't see any use of accessory muscles. So I want to begin by noting that the AP diameter is less than the lateral diameter, which is a normal finding. I'm going to palpate the costovertebral angle and check for tenderness. Does that hurt?
No.
What about that?
No.
Okay, now I'm going to check for chest wall expansion. Please take a deep breath. And again. Okay, so the chest wall expansion is even, and what I was doing was just checking to make sure that the rise and fall of my hands was symmetric, which it was. So before I move on, I'm going to check for tactile fremitus, which I'm going to put the lateral aspect of my hand on his chest and have him say 99.
99.
Please keep repeating.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay. I'm going to feel your chest, making sure that there's no evidence of crepitus or any nodules. Okay, which there's not. Also, with the tactile fremitus, the vibrations that I could feel on my hand were symmetric bilaterally, and that's an important finding. Okay, now I'm going to percuss your lung fields. And what I'm hearing is resonance, which is a normal finding. If I were to hear hyperresonance or dullness, that would be an abnormal finding that would warrant further investigation. Raise your arms slightly. I'm going to check the lateral. Okay. Great. So I heard resonance in all lung fields, which is exactly what I want to hear. Now I'm going to check for diaphragmatic excursion. If I could have you take a big deep breath and hold it, please. Okay? Okay, you can breathe. Okay, so what I just did was I percussed, and what I was waiting for was for the sounds of resonance to change to sounds of dullness. So I'm going to draw an imaginary line here. Okay, now I want you to take a few deep breaths. And when you're ready, I want you to exhale completely and then hold your breath up with the exhalation. Okay, so you can breathe normally. What I did this time was I percussed waiting for the dullness to change back to resonance. And that's the space between the two is the diaphragmatic excursion. And in this instance, we have a normal finding because it's within 3 to 6 centimeters, which is what we expect. Okay, so now I'm going to auscultate using the diaphragm of my stethoscope. Okay, deep breath. Now I'm going to listen to your lateral chest, paying very close attention to your right middle lobe. Wonderful. Would you mind turning back around for me? Now I'm going to listen to your anterior chest. Listen to the lung sounds. Great. So in all fields, in all lung fields, the respirations or the sounds were clear. I didn't hear any evidence of crackles or wheezing, which is great. I didn't hear any coarseness, and the lung sounds were definitely not diminished. So great normal finding. Okay, so looking at the anterior chest, I want to note again that the respiration seems to be symmetric. He appears to be in no acute distress. I don't see any visible pulsations or heavings. So I'm going to begin by palpating, checking for any crepitus, which I don't feel. Okay, and I'm going to feel here for any heaves or lifts, which I don't feel. Palpating the precordium now on the left and base. Okay, and I did not feel any heaves, thrills, or lifts. So now I'm going to palpate for the apical impulse. You can breathe normally. Can you lean forward for me just a little? Okay. I'm now able to feel the apical impulse, just briefly though. Okay, go ahead and lean back. Okay, I'm going to percuss your lung sounds on the anterior portion of your chest. Again, I should hear resonance. Great, and I heard resonance everywhere, no evidence of hyperresonance or dullness. So now I'm going to listen to your heart sounds. I'm going to listen with the diaphragm and the bellow of my stethoscope. I'm going to begin with aortic, pulmonic, Erb's point, tricuspid, and mitral. Changing to the bell of my stethoscope, we have the aortic, pulmonic, Erb's point, tricuspid, and mitral. I want to mention that typically we would listen to the lung sounds and heart sounds underneath the patient's shirt for the instance of being able to see placement of the stethoscope. I'm doing it on the outside of the shirt. All heart sounds were normal, had a great regular rate and rhythm. S1 and S2 were positive. I did not hear S3 or S4 or any murmurs, gallops, or rubs. Okay, so can I have you lay down? We're going to move on to the abdominal assessment. For this portion of the assessment, I'm going to raise your shirt. Okay. So I want to begin by just looking at the abdomen, noting that I don't see any obvious movement in the abdomen, whether it be vascular or bowel movement. The skin color is symmetric. There's no evidence of skin coloration changes. The umbilicus is midline. The contour is symmetric. Okay, next I'm going to auscultate for bowel sounds in all 4 quadrants and then vascular sounds. So for the bowel sounds, I'll use the diaphragm of my stethoscope and then right lower quadrant, left lower quadrant, left upper quadrant, and right upper quadrant. Great, and there's positive bowel sounds in all 4 quadrants. So now using the bell of my stethoscope, I'm going to listen for vascular sounds. So this is the aortic, renal, iliac, and femoral. Okay. I did not hear any bruits. Okay, now I'm going to percuss, and what I expect to hear is tympany. Great, and I heard tympany in all areas. If I were to hear dullness, it could signify that there's a mass, and that the mass could be something as significant as a tumor, or it could be something as insignificant as stool. So now I'm going to percuss for liver borders. Okay, let me try that again. Okay, so what I'm doing is waiting for tympany to change to dullness. And now for resonance to change to dullness. Okay, so what I have here is a normal finding, because a normal liver span could be anywhere from 6 to 12 centimeters. Okay, now I'm going to percuss for splenic dullness. Okay, I found at about the 10th rib, which is a normal finding. Okay, now I'm going to begin with palpation. First, palpating lightly, feeling for any tenderness or masses. Please tell me if anything I'm doing is hurting you. Any pain anywhere?
No.
Okay. Now I'll move on to deeper palpation. Again, feeling for any tenderness or masses. Okay, anything hurting you?
No.
I was not able to feel anything. So now I'm going to check for liver borders. If you could take a deep breath in and exhale. Okay. I'm not able to palpate any liver borders. Okay, now I'll check for spleen borders. Deep breath in and exhale. Great. I'm also not able to feel any splenic borders. That's a normal finding for the liver and the spleen. If I was able to feel the splenic borders, that could mean the patient had splenomegaly. Okay, now I'm going to palpate for the kidney, the right kidney. Which I'm unable to feel. And the left kidney. Which I'm also unable to feel. Now I'm going to palpate for aortic pulsations, just slightly left of midline. I can't feel any aortic pulsations either. Okay, and lastly, if you could raise your head ever so slightly, I'm going to check for muscle symmetry. Make sure that there's not any evidence of herniation, which there's not. Okay, you can go ahead and lay back down. Rest your head. Would you like to scoot down a little bit more? Is your head comfortable?
No, I'm okay.
Okay. So moving on, I'm going to look at the lower extremities. I want to note that I'm going to pull your pants up a little bit if that's okay. I want to note that the skin appears to be pink. The muscle mass appears to be well conditioned. There's no evidence of atrophy. The hair distribution is even. The joints are without any redness or edema. So now I'm going to begin by palpating, noting that, like I mentioned, the muscle mass is well developed. There's no atrophy. The joints are not red. They don't appear to be tender. Is there any pain in your joints?
No.
Okay. The skin is nice and warm. Moving down to the ankles. And again, there's still no joint redness or inflammation. I don't notice any edema in the lower extremities. Okay. Check this leg as well. Now I'm going to check for pulses, checking the posterior tibial. All pulses are 2+. Now I'm going to check for reflexes. I could have your wrist. Radial. Okay. Knee. And Achilles. Great. Okay. If you could go ahead and stand up for me. Need help?
Nope.
Okay, so if you wouldn't mind facing that way for me. Okay, what I want to note now is that the cervical and lumbar spine are both midline. I don't see any evidence of scoliosis or kyphosis. If you could bend over and touch your toes. Great. Again, the lumbar and cervical spine are nice and symmetric. I don't see any evidence of any curvature of the spine. Okay, great. And go ahead and have a seat for me again. Okay, I'm going to test your muscle strength in your upper and lower extremities. If you could put your arms out like this for me. Don't let me push you down, okay? Great. And if you could put your arms down now. If you could squeeze my hands. Great. Okay, and if you wouldn't mind, put your feet out. Okay. And push down on the pedals. Great, and don't let me push you back. Great. So your muscle strength is equal in all 4 extremities. I don't see any evidence of problems. So I want to thank you for being my patient and letting me work with you. And thank you for watching. That's the end of my head to toe assessment.